Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Chronic pancreatitis, the resection and the hybrid surgical procedures. So first let's look at the beggar's procedure. So beggar's procedure. So this is the duodenum preserving pancreatic head resection. In short, it is known as a DPPHR. So let's expand it. That is a duodenum preserving pancreatic head resection. So duodenal preserving pancreatic head resection. So what happens here is there is a completed resection. There is a completed resection. So completed resection after the transection of the pancreatic neck. So this will be after the transection. So after the transection of the pancreatic neck, and there is a subtotal removal, and there will be a subtotal removal. So here there is a subtotal removal, and this is of the pancreatic head. And there is a preservation of the distal common bile duct. There is preservation, and this is of the distal common bile duct, of the distal common bile duct, and also the duodenum. So there is a complete resection of the anastomosis. There is also a complete reconstruction, and this is of the anastomosis, and this is nothing but to the distal pancreas. So to the distal pancreas and to the proximal pancreatic rim, and to the proximal pancreatic rim, and this is by the same Rox limb of the jejunum. This is of the same Rox limb of the jejunum. Next, what we look at is the Fraze procedure. So Fraze procedure is a local resection of the pancreatic head. It is a local resection, and this is of the pancreatic head, and this is with the LR-LPJ. LR-LPJ stands for the longitudinal pancreatico. So it's a longitudinal pancreatico jejunostomy, and it provides a complete decompression. It provides a complete decompression, and this is of the entire pancreatic ductal system, of the entire pancreatic ductal system. The reconstruction is performed with a side to side. The reconstruction is performed with the side to side Rox NY pancreatico jejunostomy. Next, we move on to the Warren's modification of the beggar's procedure. So it is a Warren's modification, and it is of the beggar's procedure. So here the burn modification that includes the Becker plus the Frey procedure. So it involves excavation of the central portion. It includes the excavation. So there is excavation of the central portion. Excavation of the central portion and of the head. Excavation of the central portion of the head, and this is without a formal division of the neck. So it is without the formal division, and this is of the neck. Next we move on to, there is another procedure known as the Hamburg's modification of the Frey's procedure. Of the Frey's procedure. Now let's look at some of the surgical treatments for the chronic pancreatitis. So surgical treatment, there is resection. So under resection it includes the pancreatico-duodenostomy. So it is pancreatico-duodenostomy. So pancreatico-duodenostomy, it includes the Koch. There is Koch-Whipple procedure. The Koch-Whipple procedure. Next, it includes the pylorus preserving pancreatico-duodenostomy. There is pylorus preserving pancreatico-duodenostomy. So this is aka the transverso-Longmire. So this was nothing but the transverso-Longmire. Next, it also includes the resection. There is a Becker's procedure, as well as the near total or total pancreaticotomy. The near total or the total pancreaticotomy. Next, let's look at the decompression of the drainage. So under the decompression of the drainage, this includes the dual procedure. So there is dual procedure, and there is also the Pustow-Gillespie procedure. Pustow-Gillespie procedure, and there is also the presence of the Parkington. There is Parkington-Rochelle procedure. So this is nothing but the Pustow, and there is also the Isbicki procedure. Next we move on to the hybrid. Under hybrid, it includes the resection and the decompression. So there is resection plus the decompression. So this will include the Frey procedure and also the Hamburg modification. And next, it also includes the burn modification. To learn and grow daily like this, please do subscribe.